President Biden continued to spend his first full week in office signing executive orders. Thursday's batch focused on health care coverage and includes one directive targeting a signature policy passed during Mr. Biden's time as vice president in the Obama administration. CBS News Chief White House correspondent Nancy Cordes has the latest.
Obamacare was the focus today.
To undo the damage Trump has done.
President Biden announcing a special 3-month enrollment period for the Affordable Care Act on healthcare.gov, starting in 2 weeks. Pandemic-related job losses have pushed the number of uninsured Americans who would qualify for coverage to an estimated 15 million people.
I'd like to terminate Obamacare, come up with a brand new, beautiful health care.
The Trump administration cut funding to promote healthcare.gov, which led to a drop in new enrollments.
More inaccessible, more expensive, and more difficult for people to qualify for either of those two items, the Affordable Care Act or Medicaid.
The Biden White House has touted its moves to boost weekly COVID vaccine supply by 16%. But that's still only enough to immunize 2% of U.S. adults each week.
Can you give the American people any hope that the vaccine supply is going to go much over 10 million doses a week for the next couple of months?
We will all continue to push. But the issue is not just vaccine supply. A big issue is vaccinators and the capacity to have people who can put the vaccine into the arms of Americans.
The main issue is supply, isn't it?
It's one of the issues. We will be in a place by this summer where we will have enough supply for the public.
And Nancy Cordes joins me now from outside the White House. Nancy, let's start with the president's executive orders on health care. Why is the administration focusing on health care enrollment and reversing policies that restrict abortion rights right out of the gate?
Well, first of all, because there are a lot more people who now need health care coverage after losing their jobs due to the pandemic over the past year. So it's estimated that there are now 15 million Americans who qualify for health care coverage under the exchanges. And so the Biden administration is now throwing open enrollment for another 3 months. Typically, enrollment's only open for about 6 weeks at the end of the year, though you can apply for a waiver at any time if you have lost your job or have had some other life change, but a lot of Americans don't know that. So they're going to be advertising heavily, letting people know that this option exists. And obviously, this is a big change from the past 4 years, where not only did the Trump administration want to eliminate Obamacare, they went after it in court, but they also cut back on the marketing budget, which meant that we didn't see the kind of increases in new enrollments that we had in the Obama years. And don't forget, those were the Obama-Biden years. So crafting the Affordable Care Act was one of the signature achievements in President Biden's view of that presidency. And so he's now trying to restore interest in it, restore the marketing, and make sure that people know that the exchanges are an option if they need coverage.
And I want to go back to that exchange that you had with White House Press Secretary Jen Psaki. You also asked about domestic pharmaceutical companies producing vaccines developed by their rivals. What is the White House saying about that?
Well, they aren't saying much. They have said that every option is on the table and that they're looking into anything that they can do to boost production, but they haven't said anything concrete about this notion of compelling or encouraging big pharmaceutical companies to produce vaccines that were developed by their rivals. Interestingly, this is a strategy that we're seeing emerge in Europe, where Sanofi, a French company, just agreed to produce 125 million doses of the vaccine that was developed by its rival Pfizer. And Novartis, another big Swiss pharmaceutical company, says that it too is going to get into the game, and they're actually having very active conversations right now to figure out whether they can also produce the vaccine, or at the very least take the vaccine and put it into vials to help get it ready for shipment. So it's kind of an all hands on deck approach, and the question is whether that's being pursued hear, either just in the private sector among pharmaceutical companies, or whether it's something that White House officials are trying to pursue as a means to boost production so that the U.S. doesn't have to wait until the summer to get a really enormous batch of doses that would enable a lot of people to get vaccinated all at once.
I want to shift gears with you and talk a little bit about immigration. The Biden administration was also planning to release a series of executive orders on immigration this week. We're now learning that they will be delayed. What's behind that, Nancy, and what were these plans set to really address?
Right. White House Press Secretary Jen Psaki was asked multiple times why the delay. She didn't really give an explanation. She said there are a lot of reasons why plans like these can get delayed. We're putting the finishing touches on it, and it will happen next week. So we know that these executive orders will be signed next week at some point. They have to do with reuniting families that were separated at the border, rolling back some of the visa restrictions for temporary workers and more high-skilled workers that were put into place last year during the pandemic by the Trump administration. So these are executive orders that the immigration rights community has really been pushing for some time and is really looking forward to, but it looks like they're going to have to look forward to it for a few more days at this point.
One last question before I let you go. I want to ask you about the president's proposed $1.9 trillion coronavirus relief bill. Jen Psaki addressed reports that the bill was going to be split. She said the proposal did not come from the White House. What's the latest on getting the plan passed?
Well, the latest is that the White House is continuing to insist that it wants a bipartisan deal, even as Democratic allies in Congress prepare for the possibility that that will not be achievable. And so House Speaker Nancy Pelosi said that she is readying a bill that could be pushed through solely with Democratic support if this bipartisan approach doesn't pan out. But at the same time, the president himself continues to pick up the phone and call Republican senators. Susan Collins of Maine said she had spoken to him. I believe Rob Portman of Ohio had spoken to him as well. It remains the hope among White House officials and the president himself that they can do this on a bipartisan fashion. You know, it would be a big win for this president to be able to clinch a bipartisan victory this soon into his term. But they realize that that's going to be difficult. If you just listen to Senate Republicans, even the ones who say they want a deal, they're also really reluctant to support anything that's anywhere near the size of the package that President Biden is proposing, $1.9 trillion. So it would seem at this point that either the White House would have to dramatically scale back its ambitions in order to get some Republican support, or that it would have to pursue this go-it-alone approach using only Democratic support. So that's what we're watching to see right now, how that goes down.
It is interesting to see the different styles of the different presidents, isn't it, Nancy? Well, thank you.
You're welcome.